Well, actually, I have cancer, and I was a patient of Dr. Nair over here at the Waxahachie Hospital. And when I finished chemo, blessedly, I'm in remission, this Dr. Wright was recommended by Dr. Nair. So I came on in to get what I thought was going to be only a tooth repaired. I'd had a piece of a tooth fall out. And Dr. Wright said, "You're in bad shape." As a result of the chemo, your teeth are adversely affected. And I tried to keep up with everything, but it's very difficult during chemo. So I said, "Well, can you show me?" And of course, he took all the pictures and all this kind of stuff, and it was apparent even to me, who was not an expert, that there were major problems with the bottom part of my mouth. We're going to wait on the top part, and so he explained what he would do. He gave me several alternatives, and I asked him if I was not too old to get the implants, whereupon he said he just had a man in who was 90 or something. So I said, "Well, I haven't made it to 90 yet, so I guess I'm not too old." And so that's how I got here. The staff here, not to put down Dr. Wright, but the staff here is just absolutely wonderful. I couldn't say enough about them, especially Kelly. Any problem you have, even if it's not with your teeth, any problem, Kelly's available. And Dr. Wright and Kelly both gave me their home phone numbers so I could reach them. And of course, that is rather unusual these days. And he explained it very clearly, exactly what would happen and what he would do. And so that was a combination of, it sounded like he knew what he was doing and the staff was going to be wonderful. So that was a good combination for me. Anybody is going to be nervous with something like this. In my case, they had to take out every bottom tooth that I had. And knowing that in advance is going to make you a wee tad nervous. But the procedure was fine. I was surprised at how many people were involved. It was like being in a small operating room. But there's no pain. You have to be aware during the procedure, but it's sort of like, I guess it's that twilight sleep or whatever they call it. And the procedure itself was really, relatively speaking, was nothing. I mean, I didn't have any complications, I didn't have any pain. If I were coming in to have this done, I wouldn't be worried about, I wouldn't sit up nights worrying about what's going to happen during the actual procedure. Dr. Wright's going to take care of you. I think it is the confidence I have that I can eat anything I want, and this is a permanent solution. I won't have to worry about, well, maybe something will break, or maybe I'll have to go back for an emergency and have this or that, although they've always been available if I have any problems. This is a big deal. I'm not going to say it's not a big deal. You want to go to someone who seems established, stable, competent, and still pleasant and welcoming. And that was exactly what I got.